COVID-19, younger adults' obesity linked to more severe coronavirus. It is becoming increasingly clear that obesity is one of the biggest risk factors for severe COVID-19 disease, particularly among younger patients. Newly published data from New York show that among those under 60, obesity was twice as likely to result in hospitalization for COVID-19, and also significantly increased the likelihood that a person would end up in intensive care. Obesity, in people under 60 years old, appears to be a previously unrecognized risk factor for hospital admission and need for critical care. Similar findings in a preprint publication, yet to be peer-reviewed, from another New York hospital show that, with the exception of older age, obesity BMI greater than 40 kilograms per square meter had the strongest association with hospitalization for COVID-19, increasing the risk more than sixfold. Meanwhile, a new French study shows a high frequency of obesity among patients admitted to one intensive care unit for COVID-19. Furthermore, disease severity increased with increasing BMI. Patients with obesity should avoid any COVID-19 contamination by enforcing all preventive measures during the current pandemic. They also stress COVID-19 patients with severe obesity should be monitored more closely. Those with obesity are young and become very sick, very quickly. They were just obese, they seem to have a very specific disease. Something different from that seen before, with patients becoming very sick, very quickly. Obesity and severe obesity were significantly more prevalent among the patients with COVID-19. A key finding was that those with a BMI greater than 35 kilograms per square meter had a more than sevenfold increased risk of requiring mechanical ventilation, compared to those with a BMI less than 25 kilograms per square meter. Even after adjusting for age, diabetes, and hypertension, obesity in under 60s at least doubles risk of admission in U.S. Obesity wasn't a predictor of admission to hospital or the ICU in those over the age of 60 years, but in those younger than 60 years. Those under age 60 with a BMI 30 to 34 kilograms per square meter were twice as likely to be admitted to hospital, compared to those under age 60 with a BMI less than 30 kilograms per square meter. Likewise, those under age 60 with a BMI equals 35 kilograms per square meter were more likely to be admitted to acute and critical care. Unfortunately, obesity in people under 60 years is a newly identified epidemiologic risk factor, which may contribute to increased morbidity rates with COVID-19 experienced in the U.S. Just under half of patients, 48.7%, were hospitalized, of whom 22.3% required mechanical ventilation, and 14.6% died or were discharged to hospice. The research was posted April 11 on medRxiv. It showed that, apart from age, the strongest predictors of hospitalization were BMI greater than 40 kilograms per square meter and heart failure. It is notable that the chronic condition with the strongest association with critical illness was obesity, with a substantially higher odds ratio than any cardiovascular or pulmonary disease. Is inflammation the culprit? It believes that the culprit behind the increased risk of disease severity seen with obesity in COVID-19 is inflammation, mediated by fibrin deposits in the circulation, which his colleagues have seen on autopsy, and which block oxygen passage through the blood. This may help explain why mechanical ventilation can be less successful in these patients. The answer is to get rid of this inflammation. It was observed that obesity is well recognized to be a pro-inflammatory condition, and their findings show the importance of inflammatory markers in distinguishing future critical from non-critical illness, noting that among these markers early elevations in C-reactive protein and D-dimer had the strongest association with mechanical ventilation or mortality. Obesity is characterized by an impairment of immune response, and by a low-grade chronic inflammation. Furthermore, obese subjects have an altered dynamic of pulmonary ventilation, with reduced diaphragmatic excursion. These factors, alongside others, may help to explain the current results, and stress the importance of close monitoring of those with obesity and COVID-19.